So we started out with the last 7.5 years using 2 of our Class 4 lasers, and have been pretty happy with this. We invested in, to start out, 2 kits. For the in-hospital use, we picked 2 of our offices. We have 6 offices, and for the test trial, we picked 2. So 1 in Valley Stream, 1 in Bayside. Basically, that comes with 3 of the MyPet laser rentals and 1 in-house ActiVet Pro. And we were a little skeptical. We had 6 of them now for rentals. How was it going to rent? How was it not going to rent? And after pretty much just the 2 of us the first month of putting it out there, we were finding ourselves short and trying to figure out who was returning one, when was the next one. So after the study and when we saw the results and the feedback, based on that, we invested in 2 more sets. So right now we currently have 12 rental units, and we have 4 units, one for each office. And basically the in-hospital, we have a stand-in machine, not a portable unit, that they can use right in the surgery room. So basically that comes down to, what, 12, 16, 17 units in hospital, and then I bought a personal unit for myself, so 18 of them that we're actually using right now. Marketing has only been myself and Dr. DeFeis hand-picking these clients for the study, whether they were long-term clients where we felt safe with the equipment being out and being responsible for this equipment.
To make sure it
came back was probably our hardest thing, so a good tracking system is pretty easy to put in place, and that's what we've done now. Once we market this, as far as whether it's direct mail, email, blast to our 28,000 plus clients amongst our 6 offices, we project we'll probably be needing to purchase many more, but that's our goal, that's our hope. It's bringing a lot of pain relief to our clients and patients, and it's been a great product. I think it's going to be a home run. So.
The goal is probably to have anywhere between 15 and 20 out a month. And we really haven't marketed at all on cats yet. And as you said, there is no pain medicine for cats. So once people find out that there's something for cats, there'll be more interest in it, because no one wants to bring their cat to the vet. They're indoor, they feel they don't need shots, they don't need anything. Once they find out there's some kind of pain relief, it will take off with cats more than any other, more than dogs, unfortunately, because dogs at least have pain medicine.
Yeah. And it all goes into the pricing also. I think we're good with the packages we have now for the single week, the 2-3, when we're doing a 2-3 week rental. For the long-term DJD, it's either we're going to be selling the units to them, but I think I'd rather stick with a rental program than that and not worry about having to have it returned, it broke, and then we're responsible for someone else's equipment. But the rental for long-term, we'll probably be putting a package together that is 3 months at a time, because it's not something you will continue after the first couple of weeks. You want to take 4 to 7 days off before you start back in on that every other day as a long-term. It's just like some of your pain medications, I guess. There seems to be a little tail off after the first use, unless you give up some downtime.
Yeah, it's overstimulation of the muscle, and it causes the muscle just to stay cracked. So it winds up causing more pain, so you need that relaxation for it to go back to its normal state.
But what's funny is, if it's one location, that's kind of the truth to it. So everyone is unique. Commonly in our older pets, it's more than one joint. So, I could see the need where they would have continual use, where they're working on the lower back one time, the shoulders another week, different parts of the body.
Yeah.
Yep. So I could see it being as a constant use.
Yes.
Probably rational to say, too, that people will use it for a couple of weeks, maybe a month, and then come back in a few months for a tune-up.
Correct.
Especially with arthritis.
Correct, and we try to hold them together between, it's not just laser treatments we're doing, we're using other products to help rebuild the joints, increase the joint fluid, using special diets to help the same kind of thing, decrease the high antioxidants to decrease inflammation, slow down degeneration.
Mm-hmm.
Acupuncture, there's herbs we put in, there's non-steroidal,
anti-inflammatories, which we go back and forth on.
There's so many things that we use besides this, and putting it all together just makes the animal more comfortable.
Sure.
It's another tool in the multi-modal.
Exactly.
Yep. So on a 1 to 10 scale, how much do you recommend this to vets?
Probably 10. I mean, the ease of use is my main selling factor. Anyone who has the other laser knows it's a project to get it all ready. You have to set it up. You have to put goggles on. You've got to make sure you're in a room where no one else is in. There's a sign that goes up that says, laser in use, please do not open door. It's so much of a pleasure just to have someone come in the room, put it on, and say, we're going to laser your pad. So it's ease. You know, it takes... When I started doing this, I actually wanted to stop because it was just too much time. I don't have that much time in the day.
Previously.
Between treating it and then getting it all ready, acupuncture, it just took me all day. Now with this new technique where I could just stay in the room, they just hand it to me. My staff knows. They just hand me the laser, it's ready on, I do it, I'm done.
Yep.
You know, 10 minutes, I'm done.
It's a 10 out of 10. It's, you know, if you go back to do no harm, there is no harm with this. That's the beauty of it. The class 4, I do a lot of avian exotics, and when we use the class 4 on parakeets and things like that, you really got to be careful where you end up. You burn. And that's one of the big concerns using the class 4s. And therefore, it has to be done in the hospital, has to be highly trained, either the doctor or licensed technician doing it. And you got a lot of precautions. With this, you know, we still give the guard of, you know, be safe, wear the glasses. However, I can go to sleep at night and not worry that I'm going to have somebody calling up that they're blind the next day. Or they burned and the skin is sloughing on their pet who just had orthopedic surgery with us. So I agree with Dr. DeFeast, even up to the part where no longer do I, it's rare that I do the procedures myself anymore. I'll start off, as I said, and usually our doctor assistants have really enjoyed doing this. They've watched us, they've learned how to do the procedures, and it's giving them more of a feeling of worth, you know, during their job. They're enjoying their job more because they're part of this healing process or preventing pain process.
And they're learning a new technology,
Absolutely.
Yeah.
a safer one.
Yep.
Yep. So 10 out of 10 for both of you.
Yep.
Absolutely.
Sounds great. Thank you both very much.
You're welcome.